Welcome to our Discoveries and Diagnoses virtual event. I'm Tina Reed, Healthcare Editor at Axios, and I'm coming to you from Washington, D.C. Welcome to our audiences on Facebook, YouTube, LinkedIn, and on Axios.com. Join the conversation today on Twitter with @Axios and hashtag Axios Events. Over the next 30 minutes, we'll explore the future of the diagnostic journey for patients with rare diseases. Our first guest is the Acting Director of the National Center for Advancing Translational Sciences, Dr. Joni Rutter, joining us from Silver Spring, Maryland. Welcome, Dr. Rutter.
Hello, thank you for having me.
I wanted to start today's discussion by just really defining the problem first. What do we mean when we say rare diseases, and how many people are impacted by them?
So there are rare diseases. It's a term that is often confusing because rare diseases are not rare. There are we think about 10,000 diseases that we know about, and about 70% of them are, if we take the round number of 10,000, there are probably more, but if we take the round number of 10,000, that means that there are 7,000 rare diseases. And so 7,000 rare diseases in the United States, and essentially the definition of a rare disease is that it affects fewer than 200,000 people in the United States. And so in the United States, rare disease prevalence is around the order of 25 to 30 million people who have a rare disease. And that is on the order of type 2 diabetes and other types of common diseases that we often hear about. So collectively, rare diseases are quite common, but individually, for a given rare disease, they can be very rare. Sometimes even what we say is ultra rare, where it affects maybe even fewer than 100 people within the population. So that's the real problem that we're thinking about. When there may be up to perhaps 100 people with rare diseases for thousands of those kinds of diseases, it becomes really a public health problem. But for any given one, there's not really commercial interest that's available for then treating those rare diseases. So that's the problem that we're trying to tackle with thinking about rare diseases as a public health problem.
And jumping off of that, what are the biggest difficulties of identifying and diagnosing rare diseases and then actually finding a treatment for those rare diseases?
You've hit on a tough question. It does make it very difficult, with the prevalence being as it is with those rare diseases, for our healthcare system to really see these individuals within the systems itself. That means we have to have a higher prevalence. And so it makes it very difficult for our healthcare system to keep track of or even define using our standard classification system. So in our healthcare system, we use something called the International Classification of Diseases codes, or they're called ICD codes. And those are typically seen in a variety of common diseases and how we track many of our healthcare problems. But for rare diseases, they don't typically have these types of ICD codes. And it makes it very difficult for us to track patients who have rare diseases in our healthcare system. And if we can't track them, then that means that they're not getting the appropriate care. They're not getting the appropriate treatment that might be available for them that could have disease modifying effects. And it makes their appearance in our healthcare systems, it takes it much longer for them to actually be seen by doctors and know particularly how to treat them. And that's if we know more about the disease. And so I think that the problem about identifying people who have rare diseases in the system is a pretty major challenge for us. And this is something that we were trying to tackle in a recent study that we conducted.
Can you talk a little bit about that study? And what we do about this problem?
So the study that we did, we really wanted to get a handle on the magnitude of this public health impact of the rare diseases and how to try to find individuals within the healthcare system. So we took a look at some of the rare diseases that we could find in the healthcare system. Some of the rare diseases that you might have heard about, like sickle cell disease or cystic fibrosis, along with others that maybe you haven't heard about, like Batten disease or dystonia types of diseases. And what we wanted to do was to quantify the number of rare disease patients and then to evaluate the direct medical costs that are associated with those rare diseases across the different health systems that we had access to. And what we were able to do is to take a look at those specific rare diseases and use them as proxies in the system for other types of rare diseases that may actually be invisible. So it would give us a sense of how big this magnitude of the burden of rare diseases is on our direct medical costs, if you will. And so compared to matched controls for these particular rare disease individuals, we found that there was about a 3 to 5 fold higher cost of those individuals with rare disease compared to their matched controls. And that direct medical costs, and that total to be about, if we generalize that to about the 300 million people within worldwide, or even the 30 million people within the U.S. So if you think about the U.S. alone, that's $400 billion in direct medical costs per year that we're spending on rare diseases, and so this is a huge healthcare burden that we wanted to really understand and actually put a number on. And now that we know that number, we know that research on rare diseases as a public health problem really makes common sense. And that $400 billion, I should add, it confirms and validates a previous evaluation by the Every Life Foundation of Rare Diseases that also found it to be about $400 billion in direct medical cost spending.
Wow. So what do we do about this? How do we approach it with a public health lens?
I think that there are a variety of approaches that we can do. In terms of diagnostics, for example, or even just making rare diseases more visible in the healthcare system, one of the things that we can do is try to increase our understanding and be able to classify rare diseases a bit more in our healthcare system. It's not so straightforward, but it's something that we can start to tackle and start to get a better handle on. And for those that it's going to take more time to do that, there may be ways that we can identify rare diseases in the system just by merely looking at common issues around them. For example, rare diseases often present as delayed development, or people who have seizures, or people who visit the doctors more frequently. So if we can start to track those and quantify them, then we can get a better handle on how to diagnose those rare diseases sooner and faster, and that will get them into the healthcare system much more directly. And then the other approach, of course, is thinking about the treatment side. How do we start to consider treating these rare diseases? And this is an area that we're just embarking on. We launched a new program called the Bespoke Gene Therapy Consortium. And we're very excited about this because we think of this as really a key way to start to think about treating rare diseases as a whole and not just one disease at a time.
Can you talk a little bit more about what this consortium is going to do?
Absolutely. So the consortium has two main approaches. One is to think about how to treat people with rare diseases, and I'm especially talking about these individuals who have these ultra rare diseases that are less than, maybe a handful to up to 100 individuals with these rare diseases. And that means that there's really not much commercial interest for companies out there to develop treatments. And so we're hoping that we can try to use this Bespoke Gene Therapy Consortium to change the narrative about that and encourage companies to really invest in approaches that can start to create therapies for a wide range of rare diseases rather than just one disease at a time. And so one of the first things that we're doing with this particular initiative is to take a look at something called an adeno-associated viral vector and use it as a vehicle to carry, for example, a functioning copy of a disease gene in an individual with a rare disease. We know that about 80% of rare diseases are caused by a genetic defect. And so if we can identify that genetic defect, that is the common thing that we can see in rare diseases. And so if we can tackle that common thing and start to bring in a functioning copy of those genetic defects that are in rare diseases, then we can target them with these adeno-associated viral vectors and make something that's safe and effective for individuals and provide that gene as a therapy for their rare disease. And so that's one thing that we're doing. The second thing that we're doing is we're trying to make sure that when we develop these gene therapy vectors, we do it in a way where it's going to be streamlined, meaning that it can be made available to a variety of individuals because that will be publicly available information for industry, companies, academic organizations to really think about how to use this as a platform and as a template to then build more therapies for rare diseases. So we're very excited about this Bespoke Gene Therapy Consortium, and we think it has great hopes for rare disease treatments in the future.
That's really interesting stuff. Thank you, Dr. Rutter, for joining us today.
Thank you very much.
And next, we have a View from the Top segment with my colleague, Chief People Officer at Axios, Dominique Taylor.
Thank you, Tina. Now joining us is Cheryl Schwartz, Senior Vice President, Head, U.S. Rare Disease Business Unit at Takeda Pharmaceuticals, the sponsor of this event. Welcome, Cheryl.
Hi, Dominique. Thanks so much for having me.
Cheryl, we've been dealing with the COVID-19 pandemic for 2 years, and we've all seen how important testing and diagnostics are. But you all are raising concerns around a different diagnostic challenge, one related to the time to diagnosis for patients with rare diseases. Can you give us a sense of just how widespread this problem is?
Yeah, thanks, Dominique. Unfortunately, this is a fairly common challenge for the millions of Americans who have a rare disease, because part of the complexity of diagnosing a rare disease is that a lot of healthcare providers don't actually have experience with it. And a lot of the symptoms can actually resemble those of more common conditions. So this can result in either an inaccurate or a significantly delayed diagnosis. And then at the same time, there's a lot of systemic barriers that patients face when it comes to their diagnostic journey. So, for example, we know that despite, a lot of advancements in this area, it can take on average 17 interactions across the healthcare system. So people can bounce around between different doctors and specialists before they ever receive a clear diagnosis. And so because of this, it can take up to amazingly 6 years to receive a diagnosis for a rare disease. And that can obviously result in the delay of receiving really life-altering care and treatment. So, at Takeda, we recognize that our role is, of course, to help transform the treatment of rare diseases. But like many others, we also know that this diagnostic process can be immensely challenging to navigate and ultimately so incredibly critical to care and to the long-term health outcomes of these patients.
That is astonishing. And when you think about who is most impacted by rare diseases, children, underserved populations, what do you think has been the biggest barrier to identifying these conditions earlier?
Yeah, I think there are quite a few, and I think it really varies by the individual. We certainly have the privilege of meeting people kind of across rare disease communities and get to hear their individual stories, and they're as varied as the wide range of rare diseases themselves. But certainly, the lack of equitable access to genetic screening options, both newborn screening and in adulthood, is a big barrier for a lot of people with undiagnosed conditions. Right now there's a big variation in the type of genetic tests that can be recommended or used for screenings at the state level, specifically for newborns. And that can create, an inherent disparity in access and care. And it, kind of in some ways sort of depends on the role of the dice of where a patient might actually live. So for older patients, a lack of just general awareness or access to things like genomic screening and associated genetic counseling can also make it difficult to identify conditions, particularly, as you mentioned, for underserved populations, communities of color, who might already be facing challenges to accessing, even really routine health screenings. And, I think that highlights the issue of, overall health inequities, which can sometimes unfortunately undermine access to care. So expanding requirements, federal requirements for genetic and genomic screening, ensuring consistency and coverage across states really would help to dramatically expand, the community's knowledge and understanding of rare diseases, and also really help to improve the standard of care for people living with these conditions.
And how can investments in centralized and specialized care disease shorten the diagnostic odyssey for patients with rare diseases? And I'd also love to hear what Takeda's doing in the space as well.
Yeah, I think, one immediate way to cut down on this, kind of all this fragmented interactions with the healthcare system is to create kind of a clear point of entry to care for highly trained and focused clinical teams. So this idea of, centralized medical expertise, either through designated clinical centers of excellence or dedicated care networks, really leads to a better standard of evidence-based care for patients with rare diseases. So I think that there's a variety of ways that we see this. I think one really great example is the Rare Disease Institute at Children's National Health System in DC, which is a center of excellence for rare diseases. And in addition to sort of individualized patient care that they do, one really exciting RDI initiative recently is a collaboration that they've done that Takeda's done with RDI, with Children's National, and with NORD to support something called Rare CAP. It's the Rare Disease Clinical Activity Protocol Program, kind of a mouthful. But really what that's doing is working to stand up a network system to kind of curate real-time data, clinical protocols to help standardize the process of diagnosis and care for patients with rare diseases. And that could include even input from patients and their families themselves. So having the central repository and these experts in the care of rare diseases will really help to support patients in the way they need it.
And as we think about the best way to support patients with rare diseases and their families, what does that ultimately look like?
Yeah. We talk about rare in rare disease, and sometimes without even realizing that, it's estimated that 30 million Americans, that's almost 1 in 10 people, actually live with rare diseases. I think it's a really staggering statistic to think about because it doesn't really, line up with the concept of rare. So, our hope is that by raising awareness of the issues that people face when seeking a diagnosis and ultimately managing rare diseases, that we can help to encourage meaningful reforms to support patients and their families. So it's really important to those, 30 million Americans, to all of us because of the economic impact of treating this, as a society, and to all of us here at Takeda that interact with these communities every single day and really hear their stories firsthand, that we can help to drive action to support legislative and regulatory changes at both the federal and the state level. So that can include things like expanding access to newborn screening. Congress should pass the Newborn Screening Saves Lives Reauthorization Act in 21, which is going to help states really expand and improve screening programs. State policymakers are part of that solution. That can involve advancing legislation or funding supportive diagnostic tools. And as standardization of rare disease data is another really important area of focus. And that means, enhancing data collection, like the partnership I talked about with the Rare Disease Institute. But it also means developing, better advanced technology solutions to use that data, or even developing public policy frameworks that help to address, barriers or ethical concerns around, privacy or use of clinical data or surrounding genetic testing. So I think, all of these are really important and actionable steps. And we at Takeda are really committed to working with partners and key stakeholders to advance these kinds of solutions to best support rare disease communities, patients, and their families.
Very important and worthy work. Thank you, Cheryl, for joining me today and sharing your insights and what you all are doing.
Thank you so much, Emily.
And thank you again to Takeda Pharmaceuticals for sponsoring this event. And now back to Tina for our next segment.
Thanks, Dominique. Our final guest is the founder and chief engagement officer of RareX, Nicole Boice, joining us from Salt Lake City, Utah. Welcome, Nicole.
Hi, so nice to be here.
So I wanted to get started just by how you got started in working in the rare disease space. I understand it was actually a personal experience, and I wanted you to just talk a little bit about what made you aware of what's going on in the space and got you involved.
Yeah, I mean, I think everyone in rare disease has their why. Mine was a little boy that was born in Laguna Beach, California, with extra fingers and toes and bowed bones. And, his mom and dad went through their diagnostic odyssey of over 4.5 years and ultimately had a fluke diagnosis by a physical therapist of Joubert syndrome. And during that time, I was actually working in kind of peripherally in the biotech sector and realized we had all of this extraordinary, intellectual capital and just incredible thought leaders and science emerging. And I just kept thinking to myself, how is it possible that no one knows what my friend's son had? At that time, in those 4.5 years, I started meeting a lot of other rare disease families that either had no diagnosis or some, ultra rare, strange name condition that I had never heard of. And that was kind of the launch into like, wow, this is a big, massive kind of community. And there are so many challenges. And, even over the last decade and a half, so much has evolved and changed. But what hasn't really changed is the increase in patients needing to be diagnosed, the need for support, and the need for us as the ecosystem to support patients. So, but my why is little Derek.
And so, what did you do after that when you started discovering just how big a problem this was in terms of resources for rare diseases?
I talk a lot about the, kind of evolution of the roles and responsibilities that patients face in rare disease. So today, when we started this journey, there was about 6 to 7,000 diagnosed rare diseases. And over the last decade, and we'll be coming out with a new report soon, there's actually over 9,500 with approximately 200 plus being diagnosed every year. So the community is vast. It's the largest disease community on the planet. At the time, over a decade ago, however, the rare disease community kind of just needed that camaraderie. They needed love and hugs. They needed to be able to show that there's others that are in this ecosystem that were going through the same thing. So we launched another not-for-profit advocacy organization that really existed to support patients along this kind of whole process and this continuum. And what began as love and hugs evolved as the roles and responsibilities of patients evolved, and especially as it relates to research, early stage research, and the opportunities that exist for patients to participate within biopharma and become drivers of a lot of what we know today as in rare disease research. So the ecosystem evolved, and as the responsibilities of patients continued to evolve. And so, like we say, what went from, coordination, community coordination started becoming the need for education and connections around early discovery and drug development. And then how can we support patients as they're even, launching, research efforts or even biotech companies. So just the whole role of patients have evolved so much over the last decade. And therefore, as the ecosystem has evolved, so are the needs to support patients to be the best partners possible with biopharma as well.
And so, at its simplest, what is Rare X and how does it work?
Yeah, great question. There's 3 really big challenges that face rare disease: data silos, the lack of structured and the appropriate data for research, as well as no data. And we know patient advocates in rare disease are told all the time, your gold, patients, is data. Go out and collect it. Drop the mic, walk off the stage. And what we know is that it's very complex. You have to become, tech experts, science experts, drug development experts. You have to know how to, work with biopharma, et cetera. So what we knew, however, is that we could help streamline this whole entire process. That if we truly delivered something and reimagined data connection or data collection, data connection, and data federation, leveraging a lot of new tech that is out there we could really help streamline and support patients to become those better partners. So what RareX is doing is we're a platform that is rooted in patient engagement and advocacy. We have a new approach to collecting data, leveraging new, very future thinking data governance that will help support the long game, which is breaking down data silos. We have reimagined data collection and data standardization, and the notion of building out domain modules based on validated surveys and instruments to ensure that data that's collected by patients are actually usable, and that research can rely on good, structured, solid, well-governed data that they can actually work with and engage around. We're trying to make this all super easy for patients so that they can become those best partners. And I think the long game is then creating that data ecosystem that we know is so important. So leveraging the technology with some of our partners is how can we interconnect, other data sources, whole genome, EHR records, et cetera, to create that ecosystem to support discovery and curiosity in rare disease that we know is so critically important. So that's kind of it in a nutshell. The underlying basis that makes this also super unique for rare disease patients is our entire patient engagement team, because we know how difficult this is. We know it's hard to go it alone. So we spend a lot of time on education and being available and becoming an ally, sitting at the table with patients, kind of being that trusted third party that sits between some of the work that might be happening in biopharma with the patient orgs, and just ensure that they are ready to be out there and be those extraordinary partners. What we want to do for biopharma is really streamline this process, and we want to ensure that we can de-burden patients. It's going to help create better engagement and also decrease patient scarcity. And so a lot of what we're doing is helping create kind of, 80% of the data that's collected should be just open and standardized. But let's keep room available for research studies, natural history studies, disease-specific, data collection that needs to happen that could still meet the needs of research and biopharma and research. But we got to figure out a way to streamline and automate some of the data that we know patients continue to get asked for over and over and over again. So a lot of what we're doing is creating that automation, ease of use, deburdening patients, increasing engagement and data sharing, and the ability for us to create just a more efficient approach to tackling some of these big, massive challenges in rare disease.
Can you give a specific example of when this data sharing has already been able to help a patient or set of patients?
Yeah, really quickly. I mean, there's a ton of opportunities with what we are building, because we're already building a platform that, when you think about data standardization, patient advocates and disease communities can come on the platform and they get access to standardized data governance. They get access to these standardized domain modules, and they start answering these questions. Well, we can create thousands of these kind of front doors for patient communities to come on the platform. What happens on the back end then is now everyone is collecting and standardizing and collecting data that can be analyzed together. That is what is going to be game changing. And we've already started seeing correlations between some of our early pilots across diseases, where researchers were like, oh, I know this disease, I work in this disease, but here is a disease that I know that there's some commonalities and common phenotypes, et cetera, that we can tackle together. And we have other patient advocates that are coming on to say, we saw that you guys are working in this particular disease area. There are correlations with our disease, and we want our data to live alongside theirs, because you never know the end game or the long game is. At some point, a researcher is going to come on and search by phenotype, not disease, and find some of these smaller disease communities or patients that maybe no one has thought about before. So there's a lot of opportunity, and that has already started with our early pilots.
That's great. Well, final question. What advice do you have for patients who may be newly diagnosed with a rare disease, or maybe their child has been?
Yeah, you're not alone. there's a lot of support out there. And like Janet Woodcock and a lot of the leaders in the world in our ecosystem say, like, data is really important. Rare X can actually support N of 1 and undiagnosed patients just like we can disease communities. So if that's the goal and that's going to attract research and help support better care, you got to be thinking about this as a priority. In rare disease, we like to say, participation is not a nice to have, it's a have to have. And so we really want to encourage, patient advocates, wherever they go, to make this a priority, to come in, get engaged. We want to make an easy opportunity for them to be able to do this. And we're building a collaborative environment with different partners, et cetera, to help support kind of all of those kind of different pieces of the puzzle to really help usher this and patients forward in a streamlined, easy way. Again, to try to deburden and help accelerate this whole kind of, path to future treatments.
Well, thank you very much, Nicole.
Thank you. Honored to be here. Thanks, Tina.
Thank you all for joining us this afternoon for another virtual conversation that has made everyone smarter, faster. For more information and to stay updated on what matters in healthcare, sign up for the Vitals newsletter at axios.com/newsletters or check out the Axios app. Thank you all for joining, and we'll see you on axios.com.